Question 1. Who is responsible for reporting unsafe conditions like loose scaffolding on a construction site? A. Only the site manager. B. The client. C. Health and safety executive inspectors. D. Everyone on site. Answer: D. Everyone on site. Question 2. During a site induction, the fire exit procedures are unclear. What should you do? A. Wait for the next induction session. B. Ask the presenter to explain again. C. Guess what the procedures mean. D. Ask a colleague after the session. Answer: B. Ask the presenter to explain again. Question 3. When site safety rules from the induction become outdated due to new hazards, what should you do? A. Ignore them as safety is not your responsibility. B. Tell your supervisor about your concerns. C. Check with colleagues for new rules. D. Make your own safety rules. Answer: B. Tell your supervisor about your concerns. Question 4. Why is it important to keep your work area clean and tidy? A. To prevent slips, trips and falls. B. To reduce cleanup time at the week's end. C. To empty waste skips more often. D. To help recycle waste. Answer: A. To prevent slips, trips and falls. Question 5. If another contractor's work, such as noisy piling, affects your safety, what should you do? A. Leave the site. B. Tell your supervisor. C. Talk to the other contractor's supervisor. D. Talk directly to the contractor. Answer: B. Tell your supervisor. Question 6. What does it mean if a piece of equipment you're using gets a prohibition notice? A. You can use it only with a supervisor present. B. You must not use it until it is repaired. C. You can use it if you're careful. D. Only supervisors can use it. Answer: B. You must not use it until it is repaired. Question 7. What happens when a prohibition notice is issued for the entire site? A. You can keep working if it does not involve you. B. You cannot use power tools. C. You can finish your task then leave. D. You must stop all work as the site is unsafe. Answer: D. You must stop all work as the site is unsafe. Question 8. If a health and safety executive inspector issues an improvement notice after watching you work, what does it mean? A. You are working too slowly. B. Your work quality is poor. C. You are working unsafely. D. All of these reasons. Answer: C. You are working unsafely. Question 9. Who has legal duties under the Health and Safety at Work Act? A. Only employers. B. Only operatives. C. Everyone at work. D. Only self-employed workers. Answer: C. Everyone at work. Question 10. Why is the Health and Safety at Work Act important to you? Choose two answers. A. It shows dangerous site areas. B. It must be learned before work starts. C. It requires employers to provide a safe workplace. D. It explains how to do your job. E. It places duties on you as a worker. Answer: C and E. It requires employers to provide a safe workplace and it places duties on you as a worker. Question 11. Which of these is not a legal duty for operatives? A. Looking after your own safety. B. Protecting others affected by your work. C. Writing your own risk assessments. D. Not interfering with safety equipment. Answer: C. Writing your own risk assessments. Question 12. Who is responsible for managing health and safety on a construction site? A. The company safety officer. B. The health and safety executive. C. The client. D. The site manager. Answer: D. The site manager. Question 13. What does a risk assessment mainly identify? A. How to report accidents. B. The site's working hours. C. Hazards and safe ways to work. D. Where the first aid kit is kept. Answer C. Hazards and safe ways to work. Question 14. What does the term hazard mean on a construction site? A. Anything that could harm you. B. The rate of site accidents. C. A type of barrier or guard. D. All of these. Answer A. Anything that could harm you. Question 15. How do you know if a task needs a permit to work? A. Colleagues tell you. B. The health and safety executive informs you. C. You cannot start until the permit is issued. D. Only managers need to know about permits. Answer C. You cannot start until the permit is issued. Question 16. Which three things must a method statement include? A. Materials, tools, and equipment needed. B. Workers' competency and training. C. Directions to the site. D. Safe sequence of work. E. Risks you can take. Answer A, B, and D. Materials, tools, and equipment needed, workers' competency and training, and safe sequence of work. Question 17. If a method statement does not match site conditions like new obstacles, what should you do? A. Create your own work method. B. Talk to your supervisor before starting. C. Ask colleagues for their ideas. D. Contact the health and safety executive. Answer B. Talk to your supervisor before starting. Question 18. What does a permit to work allow? A. Emergency services to enter after an accident. B. Safe completion of high-risk tasks. C. Health and safety executive inspections. D. Untrained workers to work alone. Answer B. Safe completion of high-risk tasks. Question 19. How do you learn about site health and safety rules when you first arrive? A. Through a site induction. B. In a letter sent home. C. By reading the employer's safety policy. D. By asking other workers. Answer A. Through a site induction. Question 20. Why must your employer discuss health and safety with you? A. To avoid further safety training. B. To remove their responsibility. C. To share information that protects your safety. D. To say you have no safety duties. Answer C. To share information that protects your safety. Question 21. What is a toolbox talk? A. A short safety topic session. B. A guide to buying tools. C. Your first site training. D. A tool supplier's sales talk. Answer A. A short safety topic session. Question 22. Who must attend a site induction? A. Only cleaners. B. Only architects. C. Only construction workers. D. Everyone entering the site. Answer D. Everyone entering the site. Question 23. Which two topics must a site induction cover? A. Site rules. B. Cheapest parking location. C. Holiday schedules. D. Emergency procedures. E. Local amenities. Answer A and D. Site rules and emergency procedures. Question 24. What is a near miss on a site? A. An event you missed seeing. B. A situation where someone could have been injured. C. An injury needing hospital care. D. An injury causing a short absence. Answer B. A situation where someone could have been injured. Question 25. How can you help prevent accidents on site? A. By reporting unsafe conditions. B. By becoming a first aider. C. By knowing the first aid kit location. D. By knowing how to get help quickly. Answer A. By reporting unsafe conditions. Question 26. If you see a serious accident on site, what should you do? A. Say nothing to avoid trouble. B. Ask colleagues for advice. C. Call a hospital. D. Tell your supervisor what happened. Answer D. Tell your supervisor what happened. Question 27. When must you record an accident in the site's accident book? A. When any injury happens. B. Only if you take time off work. C. Only for broken bones. D. Only if you go to hospital. Answer A. When any injury happens. Question 28. Who should record an injury in the accident book? A. Only the site manager. B. The injured person or someone acting for them. C. Only the first aider. D. Someone from the health and safety executive. Answer B. The injured person or someone acting for them. Question 29. Which item does not need to be recorded in the accident book? A. Your national insurance number. B. The date and time of the accident. C. Details of your injury. D. Your home address. Answer A. Your national insurance number. Question 30. Why is it important to report near misses on site? A. It is required by law. B. To find someone to blame. C. It is part of site regulations. D. To learn from them and prevent future incidents. Answer D. To learn from them and prevent future incidents. Question 31. Where do you find out about emergency assembly points on site? A. In a risk assessment. B. In a method statement. C. During a site induction. D. In a permit to work. Answer C. During a site induction. Question 32. If you find an injured person, what is the first thing you should do? A. Tell your supervisor. B. Make sure you are safe before checking them. C. Move them to a safe place. D. Ask them what happened. Answer B. Make sure you are safe before checking them. Question 33. What should not be included in a first aid box on site? A. Bandages. B. Plasters. C. Safety pins. D. Painkillers like aspirin. Answer D. Painkillers like aspirin. Question 34. If the site's first aid box is always empty, what should you do? A. Bring your own supplies. B. Find out who is taking the supplies. C. Tell the person managing the first aid box. D. Ignore the problem. Answer C. Tell the person managing the first aid box. Question 35. If someone collapses in a confined space, what should you do? A. Enter and give first aid. B. Tell your supervisor. C. Raise the alarm for a rescue team. D. Check for toxic gas. Answer C. Raise the alarm for a rescue team. Question 36. If someone is touching a live electrical cable, what should you do? A. Call the electricity company. B. Call an ambulance. C. Turn off the power and get help. D. Pull them away from the cable. Answer C. Turn off the power and get help. Question 37. What does an emergency eye wash station sign mean? A. A place to clean safety glasses. B. A station for eye emergencies. C. A warning of splashing risks. D. A requirement to wear eye protection. Answer B. A station for eye emergencies. Question 38. If you cut your finger and it keeps bleeding, what should you do? A. Wrap it and keep working. B. Tell your colleagues. C. Wash it and keep working. D. Get first aid or medical help. Answer D. Get first aid or medical help. Question 39. If there are no hand washing facilities on your first day on site, what should you do? A. Wash your hands at home. B. Use a nearby cafe's facilities. C. Tell your supervisor. D. Bring your own water. Answer C. Tell your supervisor. Question 40. Why are illegal drugs a problem on construction sites? A. They make you work faster. B. They reduce days off. C. They put everyone at risk. D. They are a personal choice. Answer C. They put everyone at risk. Question 41. If your doctor gives you new medication, what is the most important question to ask? A. Will it make me drowsy or unsafe to work? B. Will it slow my work? C. Will my supervisor find out? D. Will it make me late for work? Answer A. Will it make me drowsy or unsafe to work? Question 42. If you have a couple of beers at lunch, what should you do next? A. Drink coffee and return to work. B. Stay off site for the rest of the day. C. Wait an hour, then return. D. Eat something and wait 30 minutes. Answer B. Stay off site for the rest of the day. Question 43. How can hazardous substances on your hands reach your mouth? A. By eating without washing hands. B. By wearing gloves inside out. C. By using barrier cream before eating. D. By washing gloves before eating. Answer A. By eating without washing hands. Question 44. How does tetanus enter your body on a construction site? A. Through breathing. B. Through an open cut in your skin. C. By eating or drinking. D. Only in animals, not people. Answer B. Through an open cut in your skin. Question 45. Why should you avoid using solvents like white spirit to clean your hands? A. They strip protective oils from skin. B. They remove the top skin layer. C. They block skin pores. D. They carry harmful bacteria. Answer A. They strip protective oils from skin. Question 46. What can direct sunlight cause on bare skin? A. Dermatitis. B. Rickets. C. Acne. D. Skin cancer. Answer D. Skin cancer. Question 47. Why is barrier cream alone not enough to protect your skin from harmful substances? A. It is too costly to use daily. B. Many substances go through it. C. It is hard to wash off. D. It irritates your skin. Answer B. Many substances go through it. Question 48. Which animal is most likely to carry Wars disease on construction sites? A. Rabbits. B. Rats. C. Squirrels. D. Mice. Answer B. Rats. Question 49. What kind of rest area must your employer provide on site? A. No rest area is required. B. A covered area only. C. A covered area with chairs. D. A covered area with tables, chairs, and heating facilities. Answer D. A covered area with tables, chairs, and heating facilities. Question 50. What is the minimum requirement for hand washing facilities on site? A. No facilities needed. B. A bowl kettle and towel. C. Cold water standpipe and paper towels. D. Hot or warm water soap and a way to dry hands. Answer D. Hot or warm water soap and a way to dry hands.